thank you everyone for joining us this afternoon. We're so excited. The yesshecan program is thrilled to have Dr. Jessica Chacon and her team with us. And I will let you introduce your team, Jessica, but today they'll be presenting a SARS-CoV-2 COVID-19 educational health fair workshop. And you can see in the schedule there in the chat box that we'll be listening to an overview, a coronavirus overview, and then testing for coronavirus, and finally how to make a mask. So thank you so much to you and your team, Dr. Chacon, for being here with us. And I will hand it over to you now.
Thank you, Diane. So Dr. Golding and I met probably about 6 to 8 months ago. I joined her team at UTEP, and it's been a really great collaboration. And I thought it would be a nice opportunity. Diane's team, yesshecan at UTEP, they have weekly workshops. And I asked Diane and her team if we can host one of the workshops and have a little collaboration with Texas Tech and UTEP. And so what we've been doing at Texas Tech over the past couple of months is developing a team strictly centered around the coronavirus. So this has basically been faculty driven. However, we brought in student volunteers. These are medical students. These are second, third, and fourth year medical students. And the medical students have really just driven everything home. They have been guided by the faculty. They have created the content, and today they're actually going to be presenting. And so with that, I want to hand it over to Dr. Jorge Cervantes, who is the faculty moderator for the overview session.
Good afternoon to all of you, and nice meeting you, and apologies for my 5-minute tardiness. So my team is composed of a great group of second-year medical students and third-year medical students. And we are going to provide you with an overview of what this new coronavirus is, what is the disease, how it is transmitted. And I'm going to give the microphone to Logan Larsen, who will start the presentation.
All right, Diego or Lokesh, do you have it pulled up that you can just kind of run it? Okay, so Lokesh is gonna pull it up, I think. Okay, great. So like was said, this is kind of a good overview of COVID-19. We'll go into general aspects of it, really good to know things. Obviously, the other groups will expound on some of the topics, but this is just an outline of all of the topics that we will be covering. The first thing, that we wanted to kind of make a distinction of is the difference between SARS-CoV-2 and COVID-19. So SARS-CoV-2 is actually the name of the virus that causes all the infections. COVID-19 is the name of the disease. So if you are infected with SARS-CoV-2, then you get COVID-19. So whenever you see those two terms thrown around, you know kind of what the difference is, because they're not exactly the same thing. And coronaviruses, they're actually a family of viruses that usually cause things like the common cold, and they'll infect your respiratory system. So on the right-hand side, you can just see just a little breakdown of how exactly COVID-19 was named. Coronavirus, virus, disease in 2019 was when it kind of came about. So this pyramid here is something that we wanted to get across, that a lot of people who are infected with this virus actually are asymptomatic, or they have really mild symptoms, which causes an issue because those people who may not even know that they have the disease, or it's super mild, they don't go seek medical attention. They don't maybe take it quite as seriously, or they don't quarantine. So those are the people where they're out and probably spreading the virus around quite a bit more. And then the people who have more severe symptoms and maybe life-threatening symptoms, they are the ones that are going to be in the hospital, not out in the community spreading it around. This pyramid just shows that a lot of people are asymptomatic or have mild symptoms, and those are the ones who usually spread it more. The transmission of this virus is through respiratory droplets. So anytime that we're talking, breathing, coughing, sneezing, we're kind of expelling respiratory droplets out of our nose and mouth. You can see that pink arrow kind of represents a super powerful sneeze where you can shoot your respiratory droplets all the way across the room. But usually just it's a few feet when you're talking, breathing. That's where our respiratory droplets go. Just a few kind of common, frequently asked questions about transmission that we can answer here is that there's no evidence currently that food is able to, you can basically get the virus through eating food, as well as animals. So it's okay to keep playing with your dog, and nor mosquitoes. Mosquitoes don't spread it as well. Okay, so here's a map that just shows the entire world and the current numbers. If you can see in the bottom right of the screen, there is a curve that shows in the entire world kind of the numbers of SARS-CoV-2 infections. So we are still, as you can see, kind of on the upwards curve in the entire world. And then we just wanted to show two other curves in Texas and in El Paso, kind of getting closer to home. You can see the curves definitely are still going up. Texas is actually even steeper than the world one and in El Paso, but we are for sure on the incline still. That the virus is still very out and about in the community. There's a lot of community spread. And if you wanted to see numbers, go and look them up yourself. If you could Google the Johns Hopkins resource, this is where we got all of those things. We just wanted to compare SARS-CoV-2 with a common virus that we see and are infected with often, the influenza virus, and just kind of make a comparison of the mortality. We can see the ones on the left represent SARS-CoV-2, and it represents the amount of deaths kind of during one of the peak weeks of this virus, and then several other weeks during the year for influenza. And as you can see, stark difference. The one with SARS-CoV-2, we have way more deaths and have definitely surpassed the amount of deaths that are caused by influenza already this year. Just to reiterate this, this little pyramid, a lot of people are mild or asymptomatic, and fewer people have severe or fatal symptoms. But there's still, since there's so many infections, a good chunk of people who have severe and fatal symptoms who would require hospitalization and to be in the ICU. Which brings me to this point. Flattening the curve has been a term that is thrown around quite a bit in maybe articles you read when people are talking about on social media this virus. Flattening the curve means two things. The first being we want to control the total amount of cases there are of the virus. And number two is we want to actually control how many people have the virus and are hospitalized at one point. Because let's say just in El Paso, we only have a limited number of ICU, intensive care unit beds and resources, ventilators. So if we were to exceed the amount of people that need the ICU beds and need to be hospitalized due to the virus, we are in big danger, really a disaster situation. So we do not want to exceed the capacity. And so flattening the curve makes sure that we can basically treat anyone who has the virus and give them the proper resources. So the more actions that we take to stop the spread, wearing masks, social distancing, we can flatten that curve and not put a burden on our system.
All right, thank you, Logan. So going back to transmission, going back to how this virus is spread, right? The virus is spread, like Logan said, through respiratory droplets, which contain the virus. And whenever someone coughs, sneezes, talks, or just exhales air in general, those droplets are released into the air. Now, those droplets can go one of two ways. They can either land directly onto another person's respiratory tract, so their nose, their mouth, maybe even deeper, or they may fall on surfaces or objects, and based on whether or not someone uses that object or immediately picks it up later and then touches their face, such as their nose or mouth, there may be spread of the virus in that way. So how do you protect yourself? The easiest way is through a combination of social distancing and wearing masks. So masks, you want to cover both your mouth and your nose because you can release respiratory droplets through both of those orifices. And you want to make sure that you do not touch your face or adjust your mask once you have it on, or as little as possible, hopefully, because you want to avoid you want to avoid passing viral droplets that you may have picked up from certain surfaces and placing those same droplets in proximity of your face where you can inhale them and get the virus that way. Social distancing, what is social distancing? You want to remain, away from other people, and that's not just for you, that's for other people as well. Like we said, there are a lot of people who may have the virus and are not showing symptoms yet, and we'll cover that soon, but they, they can still spread the virus even though they're not symptomatic. And so a good rule of thumb is to stay about 6 feet away from everyone when you're out and about. What is 6 feet? Good guesstimations would be 3 large footsteps, 2 big shopping carts, length of a twin bed, or maybe a yoga mat. And those are just some good rules of thumb to look at. So again, like we said, you want to make sure that you disinfect any surfaces that you know are going to be touched by you or someone else. Let's say you're at home and you're coughing or sneezing, or someone is coughing or sneezing on a really used surface. You want to make sure those are disinfected. You want to make sure you wash your hands, make sure that you get rid of any droplets that are on your hands. Cover your mouth or nose when you're sneezing or coughing. That's just to limit the spread of those droplets out into the air, and make sure you wash your hands after that. Keep hand sanitizer close by if you don't have a ready source of soap and water. And avoid sick contacts. That includes staying home when necessary if you come into contact with someone who gets diagnosed with COVID, or who you suspect has COVID. So we talked about survival on surfaces. That's still, there's still research being conducted on it, but from what we have seen so far, the virus survives for the least amount of time on copper. Survives up to 4 to 8 hours. In cardboard, it survives up to 1 to 2 days. Stainless steel and plastic, it can survive up to 2 to 3 days. So you want to make sure you disinfect any areas that are composed of stainless steel or plastic, or possibly even cardboard if you can, if you're going to be reusing them, or at the very least leave them out for an extended period of time until we can be sure the virus isn't there at a level that can infect you. So we talked about hand washing, and a lot of people have different conceptions of what that means. Proper hand washing is at least 20 seconds of washing every surface of your hands. That means, under the nails, at the base of your thumb, all the way to your wrists, in between your fingers, every possible surface, with soap, under clean running water, and then drying your hands completely afterward. I know a lot of people have different times, but the minimum, the absolute minimum that's recommended is 20 seconds. So what does a patient with COVID look like? Well, a patient who has COVID-19 usually has symptoms that include fever, cough, shortness of breath, and several others. There's a growing list that's on the CDC's website right now. The problem is those symptoms can appear anytime from 2 days to 2 weeks after exposure. And these patients may not develop symptoms, but may be contagious. So that is a very real concern that is leading to this massive spread of the virus as it's going around. If you develop symptoms, or if you know someone who's developing symptoms, please contact your medical provider and avoid close contact, self-quarantine, and make sure that you prevent it from getting to anyone else. So what are some complications that can occur? We talked about severe and life-threatening symptoms as well. The severe symptoms, like Logan said, coronaviruses are usually targeting the lung. That's where the major site of the infection is. And that usually leads to lasting lung damage. In the case of COVID-19, that can last even beyond recovery. Another major issue is due to that lung damage, due to the lack of oxygen, you can end up with inflammation of the heart, which is what we call myocarditis. And in addition, COVID-19 can also cause blood clotting. So depending on where the clots are, you can actually end up having brain damage from this infection at the severe or life-threatening stages.
We have a couple of questions in the chat. Sorry, Lokesh. But Dr. Cervantes is going ahead and answering those. So if you want to go ahead.
I'm typing like the wind. I just wanted to clarify something. There were a couple of questions asking if this is a nosocomial infection. So nosocomial infections are infections that happen inside the hospital. So this is a virus that is obviously in the community. So it's a community infection. But since we are hospitalizing this patient with severe disease, so it can also become a nosocomial infection for hospitalized individuals. There was another question if this is an opportunistic infection. Opportunistic infection is basically with pathogens that don't cause disease in a normal individual. So this is not an opportunistic because any individual, normal, healthy individual in the community is at risk for infection. And the third question is about pregnancy. So pregnancy is considered to some extent an immunodeficient state. Pregnant women are at increased risk for developing severe disease. Go ahead, Lokesh.
Thank you, Dr. Cervantes. So we're actually going to be talking about at-risk populations, and immunodeficient patients are part of them. So who's at risk? That'll be people who are older or have pre-existing conditions. So older patients include anyone over the age of 65. About 3/4 of all of the related deaths that we have seen are in individuals who are over the age of 65. And between 1/3 to 1/2 of those deaths have come from nursing homes or long-term care facilities. These are situations where older people are in really tight spaces, and they're all in close proximity with each other, which allows for very rapid spread and unfortunately has led to a number of deaths so far. So what are the underlying conditions I was talking about? So the major things are going to be lung and heart conditions. Like I said, lung damage and myocarditis are serious complications that can appear at the severe and fatal stages of this virus. And pre-existing lung conditions or heart conditions can cause an increase in damage. Immunocompromised patients, so anyone who has an autoimmune disease or is going through chemo or is similarly immunosuppressed in some way, they will be more susceptible to this virus. Patients who are obese, anyone who has diabetes, anyone who is a dialysis patient who has chronic kidney disease, and people with liver disease are also at risk for having severe to fatal symptoms. So then what do we do about this virus? What has worked so far? So current treatment is supportive for mild to moderate symptoms, and that means ibuprofen, Tylenol, cough syrup, rest, lots of fluids, the usual. You may have heard remdesivir being thrown around. Remdesivir is an antiviral agent that has been proven to have work in severe cases. So we give it for a course of 5 days. It reduces ICU time for patients. Another term, or in other words you may have heard thrown around, are chloroquine, hydroxychloroquine. These were potential agents that were researched, and the studies concluded that they were not beneficial in treatment of SARS-CoV-2 infection. Antibiotics, if you see them being prescribed, they are not for the virus or the viral infection itself, but because of the lung damage, you may have other bacterial infections such as pneumonia, bacterial pneumonia, as a secondary infection setting in certain cases, and that'll be what those antibiotics are used for. But they're not going to be for the virus itself. There's currently research going on, but so it's too soon to say exactly which painkillers or blood pressure medications may be implicated, but there are there are signs that certain blood pressure medications and painkillers may actually worsen the prognosis if someone's infected. Another therapy that is currently being investigated right now is convalescent plasma. And what this means is patients will, as the testing team will tell you guys soon, patients will actually develop antibodies as they recover from the virus. And the specific ones that we look at are IgM and IgG. And what convalescent plasma does is it takes the antibodies that are in recovered patients and gives them to patients who are currently exhibiting severe symptoms of the virus. And what we've seen is so CRP is a general inflammatory marker. We've seen that go down. Lymphocyte count has in general gone down as well, has gone up, and oxygen saturation has gone up, which is very good, but it's currently being investigated, so it's too soon to say anything definite.
Lokesh, maybe you can go back again to that curve graph and spend an extra minute explaining one more.
Mm-hmm. So lymphocyte count.
Go back to the curve.
Oh, yeah. Okay, yeah.
We can spend a couple of minutes here because it will be useful for the following session on testing, okay?
Oh, sure, okay. So viral RNA is how we measure the amount of virus. So this is an RNA virus, which is why viral RNA measures the number or amount of virus in your system. As patients recover from the virus, as viral RNA levels decrease, you end up developing antibodies to the virus. And the two major antibodies that we have seen in significant levels that are protective are going to be IgM and IgG. IgM is relatively short-term, and those levels do go back down after a while, but IgG is relatively long-term. It plays a role in adaptive immunity, and those are usually in higher levels. And we use, there's currently investigations being run on either of these or both of these combined to see which has the best effect on patients who are currently suffering from COVID.
So I just wanted to know that the x-axis is time. So if you see that this black and brown curve, which is the amount of virus, when it comes down, it coincides with the appearance of these antibodies from the successfully recovering host. So that's why we call this convalescence. So when you mount, or when you have good amount of antibodies, this means that you have cleared up the infection. And this is important because this is going to tell you which test is going to be good when you are in the acute phase with a virus in your body, which is going to be early in the infection, or which test is going to be better if you are like weeks after the infection, to see if you have developed antibodies and clear up the presence of the virus.
All right, and that was all we had. We have a little pop quiz at the end if we have time, but I think we are almost out of time. So any questions?
There is a question there. How many days is typical to top the viral RNA? So it depends on the report. It can go 7 days, it can go 11 days, depending on the population. Yes, it can go up to 2 weeks. And then the time scale on the y-axis also, when are you going to develop antibodies? It's something that also depends on the reports. It can be 2 weeks or it can be more than that. I don't know if you want to add anything, Lokesh.
No, I think you summed it up pretty well.
We have a couple more questions. How much plasma do you need to transfer, and what is the likelihood of reinfection?
Oh, those are good questions. So the plasma, the amount is one of the parameters that's still being investigated. So we're trying to figure out how much, what type, and how much bang for the buck we get metaphorically. Okay. And what is the likelihood of, right.
To make things a little bit more complicated, it is not just about the antibodies in the plasma, but within those antibodies, you have those that are called neutralizing antibodies. And those are the good ones that could benefit from a convalescent individual into an acute patient. So you can transfer plasma, but when they are transfusing plasma, they still don't know how many neutralizing antibodies are in that bag of plasma. So that's why the results from the reports is going to be very variable.
And then what is the likelihood of reinfection? So that is another good question. We do not know currently. We do know that we're still trying to figure out how much time, how long these antibodies last, how long people are immune to the virus, but that's still being investigated. And then, is the antibody test effective? I think Dr. Farr and his team will be able to answer that pretty well for you all.
That's a good way. Did you want to give your quiz, or do you want us to go to the next testing?
I don't want to eat into their time. I think we can go ahead to testing.
Okay, perfect. Well, thank you, Lokesh, and the overview team, Dr. Cervantes. So the next team we have is moderated by Dr. Kurt Farr, and I will hand the mic over to you, so to speak.
Thank you, Dr. Chacon. This is, my name is Kurt Farr. I'm on in the medical education department, faculty over at Paul Foster. So can everybody see my screen? I need to turn on my chat.
Yes.
Okay, so basically I'll just introduce this piece and then let the students take over. They do a great job. And what we're going to be talking about here is kind of the nuts and bolts of testing, which you've heard a lot about in the popular press and locally and so on. And the main takeaway from this is for you to understand that there's two basic kinds of tests. One is to look for the virus itself. And as that graph we looked at a few minutes ago, you can either look for the genetic component, the genome of the virus, which is an RNA strand, or you can look for antigens, different proteins that compose the code of the virus and other pieces of it. But far and away, the most sensitive detection technique is called polymerase chain reaction, or PCR, and we'll kind of go into a little bit of detail there. And that's distinct from testing for these antibodies. You just saw how the IgM and IgGs come up as the virus itself starts to fade away. And that's called serological testing, reflecting the idea that you actually take a blood sample and test that blood for the presence of these serum antibodies, as opposed to the PCR test, where you basically take a swab and stick it way up your nose and kind of tickle your brain and look for the virus particles on that cotton swab. Then we'll go into a little bit, you've heard about this testing and tracing, pairing, which is critical for actually dampening the curve, where once you've identified somebody that has the virus, you're able to kind of trace back to who they've been exposing to the virus potentially, and quarantine those people appropriately. It's roughly analogous to putting out a forest fire. You know, these horrific fires in California a couple years ago, campfire and so on. You can imagine, you know, dropping fire retardant on those and then having lookouts for kind of embers that flare back up and being able to attack those very quickly before it flares up into a full-blown forest fire again. So that's the idea of the testing and tracing. Is the virus is going to be out in the population. The trick is to catch it quickly by virus detection using PCR, and then quarantining those people and tracing out who they might have infected. Okay. All right. So I won't spend any time here. This is just and you saw this a minute ago in the previous presentation, that we're really on an exponential rise here. I was just looking at the most current numbers. We're pushing up to 11,000 cases in El Paso, which is pretty dramatic. So this is clearly an ongoing issue that will play out in the coming months. So at that point, I want to hand it over. I'll let the students introduce themselves and take it from here. And then at the end, we want to leave a little bit of time for questions and answers. All right, thank you.
All right. Hey everyone, my name is Nivi Manohar. I'm a second-year medical student here at Paulo Foster School of Medicine. So I'm going to continue on with the presentation. Oh, Dr. Farr, I think if you stop sharing your screen, it'll allow me to share mine.
There you go.
Oh,
Okay.
Awesome. Got it. Okay. So I believe you should be able to see my screen now. All right. So as Dr. Farr mentioned, there are two types of testing when it comes to COVID-19. So one detects the virus itself, and then the other one is detecting antibodies in the blood that a person makes in response to infection with the virus. So I'm going to talk a little bit about reverse transcription polymerase chain reaction, which is the RT-PCR based virus detection. So this is probably the most common type of test that's being used right now. It's what you hear about in the news when they talk about, swabbing your nose or throat. This is the test they're talking about. So RT-PCR is a nucleic acid amplification test for viral RNA, and it measures the current infection with SARS-CoV-2. So how does it work? So the first thing that happens if you go to a drive-through testing center or even the physician's office is that they will swab the back of your nose or throat. So this is done using a cotton swab, and other samples can also be taken to detect the virus, such as saliva, mucus, or fluid from your lungs, but the swab method is probably the most commonly used. So they collect the specimen, which is whatever is picked up on the swab. So the swab is going to pick up some of your body's cells, other microbes, and if you have COVID-19, it's also going to pick up some of these SARS-CoV-2 virus particles. So next, in the lab, what they do is they extract the viral RNA. So viruses have genes, just like we do, except instead of DNA, SARS-CoV-2 has RNA. So because there's not enough viral RNA that gets picked up from the swab, RT-PCR is used to essentially amplify parts of the viral RNA. So with RT-PCR, if there's viral RNA, from SARS-CoV-2, parts of the RNA will go through a process called amplification, where it's reverse transcribed to DNA, and then many copies of it are made in cycles. So how do we interpret the results? So if you test positive, what's happening is within 40 cycles, the number of viral RNA copies pass a certain threshold. And this is what we see like in the lab. So this red line here, you'll see a positive result if the viral RNA is being amplified. If the specimen collected doesn't have any viral RNA, then there would be nothing to amplify, and we'll see this blue line here. It says negative. So why do RT-PCR? So this type of testing, again, it tells you if you currently have COVID-19, which is really important to know because if you test positive, you can, take the necessary precautions and measures to, take on this illness and know that you will have to self-isolate so you don't infect others. An important caveat I will mention is that some of these testing centers are taking days to a couple weeks to get back to people about the status of their test. So honestly, the best practice is, if you think you have COVID-19, it's best to just self-isolate and just take the necessary measures to keep your family and people around you safe. And that is all I have for you all, and I'll pass it on to the next presenter.
I'm sorry, I was muted. I was probably talking for a second while muted. So let's see here. The other type of test is an antibody test or a serological test, which we touched on a little bit in the overview group talking about antibodies, but I want to kind of expound on the actual test that we can run. So our immune system, whenever we're exposed to some sort of foreign antigen or something like that, something foreign, our body will start to, I guess, start an immune response, and the end goal being to make cells that will basically attack and destroy the foreign invader. And one of the ways that we do that is creating antibodies, which antibodies will basically stick on to the foreign antigen, target it for destruction, and really rid ourselves of it. They kind of look like these little prong things. Those ends of the prongs are very specific for really specific antigens. So if we can find those antibodies within our serum, in our blood, then that would show us that we have had a COVID-19 or a SARS-CoV-2 infection in the past. So the people who get these types of tests are really people who may have had it in the past, may have had an infection, but it's not really for people who currently have an infection. That's where you want to do the RT-PCR test. So I think a question was kind of asked about this earlier is, does this give us immunity if we have these antibodies in our blood? Currently, it's not clear whether or not this gives us immunity. There's been some reports or news stories of people who have had COVID and then they get it again a month later. So it's not totally clear whether or not this shows immunity or gives us immunity in the future. We also do know that antibodies actually have a half-life, so they'll eventually degrade and they won't exist forever in our blood, but we don't know how long they last and if it actually is useful for fighting off future infections. So the way that this test is actually run is by something called an ELISA, an enzyme-linked immunosorbent assay. That's a really common way, although you can set it up in different ways. Basically what you do is you take some blood, usually like a finger prick, you don't need a ton of blood, and you'll put it on either into a little machine or on a little stick-looking thing. And on this stick or in the machine, it has the actual antigens that the antibodies would stick to if you did have the antibodies. And then if it sticks to those antibodies, basically what will happen is you'll have some sort of fluorescence or light that shows up because of that interaction between the antibody and the antigen. And so you'll be able to see a little line with a light. It works pretty similar to like a pregnancy test, where you have that little line that shows up if you're pregnant. So the importance of these tests, number one, individually, someone might be interested in knowing if they had the infection, because once more research is done, it might show like maybe you are immune to this virus in the future, although obviously more investigation is needed to be done. The other reason why this is important is understanding the big picture of this virus. So if we can do antibody tests or serological tests on the whole community, we can figure out how many people actually had the virus, figure out the transmission rates, and figure out real numbers, death rates, and everything. So currently, like we said in the overview group, there's a lot of people who are probably asymptomatic or have really mild symptoms who never get tested, so they don't probably ever count into the numbers. But an antibody test will show us that they had it in the past. And that's all I have. I will pass it to, oh, just real quick, how accurate are these antibody tests? There's always a certain level of false positive, false negatives that go on. I looked this up, and the FDA had put out that there's also a few different types of tests that they do, but they're about 95% accurate with the article that I had read in the tests that they were using for the antibody tests. Yeah. Okay, I'll pass it on to the next presenter.
Okay, hello. My name is Brenda Castillo. I am a fourth-year medical student here at Paso School of Medicine.
I'm sorry, Brenda, it's a bit hard to hear you. If you could raise your mic.
Right, does this sound better?
It's a little better, but still a bit faint.
How about now?
Brenda, you're really, really weak. Can you go into your settings real quick and check your microphone volume setting?
Speaker, microphone. I increased it now. Does it make a difference?
Yes, that's better.
Mm-hmm. Okay. So I'm gonna be talking about contact tracing, and this is basically the process that some individuals will be following in case the person themselves tests positive for COVID-19, or if you were somehow in contact with someone that tested positive. Now, this tool is used by health departments. So, and the goal is to interrupt the spread of COVID-19. Like how Dr. Farr was saying, we want to prevent the fire from spreading even more. So, basically, when someone tests positive, I'm going to be referring to these individuals as the cases. And once a case has been identified, that person is investigated as to who they came in contact with during the previous couple of days that they might have been infected. Now, once these individuals are identified, those individuals that came in contact with the case will be notified of this potential exposure by the health department. Sorry, I had a problem with audio. So now, this process, if a case is reported and the individuals that they came in contact with are identified, this process is going to remain anonymous. The person who became in contact with the case will not be notified of this individual's name or information. It's more like a general statement that you became in contact with someone that tested positive for COVID-19. And now, once the case is identified and the contacts are identified as well, the contacts can be referred for testing for COVID-19. Can I get the next slide? Okay. So now, if someone tests positive for COVID-19, people are going to be asked to self-isolate. And the same thing goes for someone that is the contact of this case. And this is going to consist of staying home, practicing social distancing, and the window of time will likely be until 14 days after the exposure. And also, since this service is done through the health department, they're also able to provide resources for someone who tested positive for COVID-19 or for the identified contacts of um, this of a case. Okay. So this presentation is about testing, and when we think about who should be getting tested for COVID-19, there's a certain categories that we're following to indicate who should be getting tested. And if you are identified as a contact for a case that tested positive, then this would be an indication to get tested. If the person is 65 years or older with underlying health conditions like diabetes, high blood pressure, or if someone is immunocompromised, like we were mentioning earlier, then that's another indication. Furthermore, if you work at a grocery store and you're often coming in contact with these individuals, so those could be potential exposures, so then that would be another recommendation. And if we think about nursing homes or military centers, people who live on these group settings, then that would be another indication to get tested. And if someone is going to be going to the hospital or clinic or anything along those lines, then it might be appropriate also to get tested in case the personnel that is going to be working with you or these individuals, they can take necessary precautions to treat you and offer further care. For example, in the UMC, the University Medical Center, where we are doing rotations at, a lot of the patients, if not all of the patients who come into the ED, are right now being tested for COVID-19 since before they are admitted to other floors where they can potentially spread the disease to other individuals without knowing. Even if the concern that brought them to the ED is not respiratory symptoms, but if they're coming in from for anything else, now these measures are being taken to prevent the spread.
Thank you so much for the overview sessions and the testing. And something that came up earlier during another meeting is this is something that we're all dealing with together. And so whether we have been exposed or somebody close to us has been exposed, all we can do is just offer each other support. Because we're all trying to deal with this together to prevent the disease, to try to go back to some sort of normalcy. So let's just try to keep that in mind. Do we have any other questions before we go on to the mask making session?
This is Dr. Farr. I'll just throw out one quick comment, and that is, of course, you're all aware that this has become a big political turmoil in terms of wearing masks and social distancing and opening bars and restaurants and so on. It's important to compare us to other countries where they've had much more stringent compliance with those sorts of approaches, and they've really attenuated the curve. I mean, they're able to open schools and get back, tracking their society back to kind of some level of normalcy in places like Taiwan and Germany and so on. South Korea had a total of 291 deaths total. And of course, it's a completely different social structure, but it just does reflect that these techniques actually work, right? It's real science and it's really effective. So that's something to hang on to as you watch the news unravel.
Yes, I think that adding to that comment, Kurt, somebody's asking is, can we overcome the virus without contact tracing? And I think the best example is Taiwan, that basically control everything at a very early point with an extensive and strict contact tracing system.
Yeah, and an important point is the virus will never disappear. I mean, because we can never do the theoretical where we would isolate every human being on the planet for 2 weeks or a month and let the virus completely disappear. That can't happen, just like influenza every season. So the trick is to keep it suppressed down to a level where the society can go on, you don't overwhelm the healthcare system and so on. So we'll never get rid of the virus totally, at least that's not known yet.
And there's another question, what about the current crisis worries you the most and what gives you the most hope? And how would you rate other countries' responses to the outbreak? So I guess for the first part of the question, what about the current crisis worries you the most and what gives you the most hope? I want to open it to our participants and open it up for discussion. What worries you the most and what gives you the most hope, as well as our students, if you want to go ahead and chime in as well.
I think what worries me the most is people not understanding the gravity of the situation. I see places like Disney World in Orlando, and I specifically say this because my brother is there at the moment. I don't think he quite understands the significance of what's happening, and it's just a bit frightening. So that's what I really worry about most is people understanding the gravity of the situation.
And what gives you hope, Dr. Golding?
You all. You all give me hope. These kinds of things help people understand, you know, what's at stake here. And I think that the more that we can educate each other and the public, I think that that's where our hope is. So I really appreciate you all doing this.
I feel the same way, Diane, when I can see the professors, the teachers and the students, and I can see them doing this and this, supporting and learning and making a difference. You folks are awesome, really. Thank you so much for sharing your wisdom with us.
Thank you for this opportunity. I'm glad we were able to have this collaboration. So the next session is more of a hands-on. So we can take about a minute break to stretch, to get up. We've been sitting for about an hour. So what will you need? You're gonna need a t-shirt, and this is my son's t-shirt. I'm gonna try to make a mask for him. I don't think he's gonna be wearing it. It has a few holes, so it's good to go. This is my daughter's shirt. I have a 5-year-old, so I thought I can make her a little mask as well. You need 2 rubber bands, so these or the elastic ones that you find on newspapers. And then you're going to need socks. So I'm going to use these as practice because these have been worn by me, but I'm going to use this as practice. And then when I get clean socks, then I know how to make a mask out of clean socks because I don't want to put this on my face. Okay. So why don't we take a minute so that we can get our items and then we'll come back again. And then the last session, how to make masks and how to make hand sanitizer at home will continue. But if anybody has any questions in the chat, please feel free. Okay, I have all my materials. Does everybody have theirs? Does anybody want to show their shirt or their sock that they're going to try? Okay, we have an audience member. R. Hearn, okay, he has his sock. You have your scissors ready and your shirt. Okay. Scissors, rubber bands, perfect. We have a lot of nice comments in the chat. Really like this platform. Thank you. And thank you to Diane and Peter for having us today. Okay, is everybody ready to get started? Should we wait for Peter, Diane?
He's on his way. He's just got his t-shirt.
Okay.
His supplies.
Perfect. Yes, so sock, and then our shirt. Well, my daughter's shirt, that's not mine. And then another shirt, and then our rubber bands. So the way that we're going to do our next session is before we go into how to make the masks and actually do the do-it-yourself with you all, we're going to give a brief overview on the importance of masks, and that way we're not just doing something, we actually understand the importance of what we're doing. Okay, so with that, I'd like to hand it over to the medical students so that they can introduce themselves.
All right. Hi, everybody. My name is Shalabi Sarakia. I'm a third-year medical student at Paul Foster. And today, me and my teammates are going to be talking to you about face masks and hand sanitizer. If you guys want to say hello.
Hi, everyone. My name is Sindhuja Devarajan, and I'm a second-year student also at Paul Foster. Thanks for having us.
Hello, my name is Aaron Murillo Ruiz. I'm also a second-year medical student.
All right, and we also have Blanca and Valeria who are going to be moderating the chat. So if you have any questions, feel free to type it in there or even unmute yourself and speak up if you would like to. So first off, I just wanted to give you an outline of what we're going to talk about. Just like Dr. Chacon said, we're going to go over a couple things about why masks are important and then give you a demonstration on how to make your own. And here are some of the objectives that we want to cover to make sure that you understand that we got all this information from the CDC website. So it's as legit as it can get, and be sure that you have all your materials ready so you can go along with our videos and our commentary and make your mask today. So first off, I just wanted to see who all already has a mask. You can feel free to type in the chat. Great, I'm seeing a whole bunch of people who do have a mask at home and that you use too all the time. Great. So what kind of materials are your masks made out of? Good, I have a cloth one too. I was laughing at Dr. Chacon's because mine looks exactly like her daughter, so I must look like a 5-year-old, but I'm completely okay with that. And as you can see from the slides, there's a couple different kinds of masks out there. I know you might have heard of something called an N95 mask that looks like a little cup on someone's face, the medical grade surgical masks, and even these cloth masks. Even though the N95s are usually the most researched to be the most effective, it's still very important to be wearing your cloth mask. And moving on, if someone could unmute themselves and tell me why they think masks are important to wear during the pandemic. Or feel free to type it in the chat, whatever makes you more comfortable.
So you're not spraying your droplets on everybody else. So you're wearing for other people.
Exactly. So that's exactly what I was going to talk about next is not only are masks, you know, there to protect you, they're also there to protect yourself and other people around you. As you've probably already seen and heard, the virus is spread by respiratory droplets. So when you wear a mask, even if it's a cloth mask, you're protecting other people from getting something that you might not know you have, and you're protecting yourself from getting it if someone else has it. As you can see, the person on the left over here does have COVID and they're spreading it around without the mask. And if they are wearing a mask, even though a couple droplets might get around out from the side of the mask, if you wear a mask yourself, you're more likely to be protected. I did have an example of how this mask works very well. Recently, I think about a week ago, there was a case report from 2 ladies in Missouri who are hairstylists, and they tested positive for COVID after treating or being with about 140 clients. And both the clients and both the hairstylists all wore masks, and thankfully, none of those clients who were tested actually tested positive. So it's a good sign that those masks are working.
All right, thanks, Shalabi. So we know that the masks reduce the transmission of the virus. And like a lot of you have already hinted at, it's because it reduces the transmission of respiratory droplets. So this picture illustrates the concept pretty clearly. You can see that there's a physical barrier that catches the respiratory droplets that leave our mouths and our nose when we cough, when we sneeze, and even when we're just talking and breathing. So without that physical barrier, naturally more of our respiratory droplets spread into the surrounding air and can be potentially inhaled by the people who are around us. So that's the benefit of the mask. And you've already heard about social distancing from the overview team, and we know that social distancing is effective and it's a necessary action, but paired with wearing a mask, it's actually the best way to prevent the spread of the virus to the people around you. We also wanted to note that when you're in a public space where you can't necessarily social distance from other people, definitely be sure to have a mask on. And that's a really good preventative measure against spreading the novel coronavirus. Okay, so I want to take a look at these 2 pictures on the screen. We have the person on the left who's wearing their mask correctly and the person on the right who is not wearing their mask correctly. Can y'all point out what is wrong with the person on the right side and why? And feel free to unmute yourself, or you can type in the chat if you'd like. Okay, the nose is not covered. Lanez, the nose is exposed. Yes, that's correct. So like we already talked about, we get respiratory droplets from our mouth, but also from our nose. So if your nose is exposed, you're not covering all of your respiratory, you're not preventing all of your respiratory droplets from being expelled into the air. So you have to cover both your nose and your mouth to fully be effective. Okay, now this next bit is a little interactive, and I'm going to show you how to effectively wash your hands. And so I'm taking a little field trip to my sink. And the reason I'm going over this is because we want to talk about how to best take off your mask and what's the safest way to do that. But the problem is you don't even want to touch your mask without washing your hands first. So you go to the grocery store, you have your mask on, the first thing you do is head to your sink. Okay, now I have a really silly way to make sure that I'm actually washing my hands for 20 seconds, and it's by singing a song. You might have heard of the Queen song, "We Will Rock You." So I'm going to ask my fellow classmates who are on the call to unmute themselves and to help me with the beat, and feel free to join in and unmute yourself. This is just to get us moving and engaged a little bit. So if I could have y'all start doing the clap, pound, pound, clap, pound, pound, clap, pound, pound, clap, and then I'm going to turn on the water. We will rock you.
We will rock you.
We
will rock you.
Thank you so much. So I did "We Will Rock You" 3 times, and that was approximately 20 seconds. And now I have to wash everything off. But make sure when you're washing your hands that you always wash for you use proper hand washing techniques. So like you just saw me, I was washing in between my fingers, on the top, around my wrist, under my nails, like so. And if you do that thoroughly, then you're really catching all of the surfaces on your hand. Now, once you do wash your hands, you want to remove your face mask. but we only want to handle the ear straps on our mask. If we touch our fingers to our mask, then we're actually touching the respiratory droplets that, you know, have caught onto our mask. And then we touch other things around our house, and we're spreading the virus in, you know, unintentionally. So only handle with the ear straps, and directly place your face mask in the laundry or in the hand wash, or go ahead and hand wash it. And we have tips on how to effectively wash your masks later on in the presentation.
Okay, hello. On July 2nd, Governor Abbott put a rule for the state of Texas mandating that face masks that cover the nose and mouth would be required in any county with more than 20 COVID-19 cases. They'd be required for people who are 2 years and older. They must be worn anytime you're in a public or outdoor space where social distancing isn't always possible. And so as of this morning, El Paso County had 10,638 cases. More about the mandate. There are a few exemptions. If you have certain medical conditions, if you're concerned about that, that's something you should ask your healthcare provider. When you're eating and drinking, obviously can't wear a mask. And then also when you are exercising outdoors. And then, like I said earlier, if you're younger than 2 years old, don't need to wear a mask. With that being said, we certainly encourage anyone who is partaking in these activities, eating and drinking with other people or exercising outdoors, to minimize that time without the mask. As far as punishments for non-adherence to this mandate, the first offense is written or oral warning, which will be given probably by the officer who's citing you. And then the second offense and any subsequent offense subject to up to a $250 fine. If you want more information or you see some non-adherence to this policy, you can call 311 and speak with someone. We also offer these resources here, the epstrong.org and coronavirus.gov for more information. A few considerations for the mask. If you are or know someone who is hearing impaired or hard of hearing, you could consider using a model like this one shown here, where you can see the mouth, and if you read lips or you know someone who reads lips, this could be helpful for them. You could also consider writing down communications between each other. Face shields are not recommended by the CDC, that's the Center for Disease Control and Prevention. But if you do want to wear a face shield, the CDC recommends that it cover the chin and sides of face of your face, and they're not recommended for newborns or infants. Final considerations: if your mask gets wet, it does get harder to breathe generally, so keep that in mind if you're sweating or going for a swim at the pool. Of course, it may be hard to exercise with the mask on. So if you want to exercise, you may just consider some actions you could take to mitigate any risks that you may incur, such as considering the difference between running by yourself outdoors versus running in a closed space on a treadmill next to other people. And then finally, if you have any concerns about workplace hazards, you can speak with your workplace occupational safety or human resources representative.
All right, so we're about to get to the fun part, but before we do that, does anyone have any questions about what we just spoke about? So what we're gonna do here is that we had some recorded videos, and unfortunately it might be a little difficult to do it live. So we'll show you the video, talk over the video, pause it if you need to, feel free to get those mask materials ready. So we're gonna start off with our sock mask, and all you really need is the hair ties, the sock itself, and some scissors. And if you check the chat out, there are some URLs to the actual videos if you'd like to watch them yourself later.
Thanks, Shalabi. So this is our classmate, Valeria Urbina, who's also on our team, and she beautifully demonstrates the sock video. We will pause as we go along to give everybody a bit of time, but feel free to turn on your videos and show everyone how you're doing in the meantime. All right.
Hi everyone, my name is Valeria Urbina, and I'm a second-year medical student at Paul Foster School of Medicine here in El Paso, Texas. Today, I will show you how to make a face mask using a sock. Although these masks are not as efficient as medical grade masks, they are a cheap and easy way to protect yourself and those around you when you're out in public running essential errands. Let's get started. First, we're going to talk about what you're going to need. You're going to need a sock that ideally is white, scissors, and something for extra protection. Today, I will be using this paper towel. So the first step is to make a rectangle using the sock. As you can see, I've made markings on this sock where I will be cutting. So from this edge, right across, all the way to the other edge, I made a marking. Same thing on the other end of the sock. From one edge, all the way across to the other.
Okay, so I'll just pause the video right there. Do we have any questions about where the markings are going? And that's where we're going to be cutting along the line. So Valeria just drew it with a marker across the front of the sock to the heel, and then kind of where the toes go in the sock as well. Okay, excellent. So get ready with your scissors, and we're going to cut along that line for the next part. Valeria in the video already has it cut out, so go ahead and start cutting right now. For some time, I'll give everybody a few seconds here, and if you'd like to turn on your video again and show us how you're doing, feel free to do that. I see some scissors. I see people looking down. That's great. All right. All right, awesome. Everything looks great. So I'll go ahead and play the video again, and Valeria will talk about the rectangle she's about to cut out.
When I cut at these markings, I will be able to make a rectangle. This is how your rectangle should look. As you can see, just a regular rectangle. The length should be about 5.5 inches. If it's a little bit more than that, that's better. It's going to cover more of your face. So now we're going to cut again.
Okay, so I'm going to pause there and just give everyone a few seconds. Okay, if y'all are ready, go ahead and say so in the chat if you're ready to move forward. The next bit is cutting the sock to make the ear pieces. So actually for this mask, we do not need hair ties. We're going to cut the ear pieces out or the ear bands out directly from the sock.
This time we're going to make the ear pieces. So as you can see, I made more markings. From this edge of the sock all the way towards the middle, about 0.5 centimeter away from the end of the sock. And I made the same marking on the other side. From the edge straight towards the middle, about 0.5 centimeter away from the end.
Okay, so be sure to measure your line that you're going to cut down about 1 centimeter away from the edge of the rectangle on the shorter side, and then you're going to cut halfway down the rectangle. I see people cutting. That's awesome. All right. And this actually creates the ear loops on the mask itself. So it's made out of the same material of your sock. It's going to be nice and cozy, and you don't have to get extra material. So it's all just from the sock. All right, so I'm going to go ahead and play the video again.
So now we will go ahead and use our scissors to cut across both of these markings. And this is how your face mask should look. Now, as you can see, you have ear pieces on each side. So now we add the extra protection, because the more layers, the more protection. So I'm going to use this paper towel. I'm going to fold it in half and fold it again. It should be about the size of your face mask. Here we go. As you can see, there's an excess amount of paper towel, so I will go ahead and cut it off. So now your paper towel is going to serve as a filter. So you place this inside. And now you have a face mask.
All right. So if you followed along, feel free to show us how your masks look. All right, I see a mask here. Really nice. I see a second mask. It's going on. And I saw a few more people as well. Looks great, everybody. All right, and as Valeria said, and as we got in the chat, you can use different types of filters. You can use Kleenex, you can use paper towels or coffee filters even to stick in the middle for extra protection and extra layers. Okay, so now we're going to demonstrate the t-shirt mask. Now this is a little bit longer and it's gonna take a little bit longer to cut out the rectangle from the t-shirt, but you're going to eventually cut out a 20-inch by 20-inch square from the front of the t-shirt. And you can guesstimate if you don't have a ruler with you, but I will also play the video for that and we'll go along with the video, okay? And just in case we haven't mentioned this, we'll provide the links to these videos in the chat at the end of the presentation, so don't fret if you can't keep up with the timing. You'll have these for reference to look at later. All right, and this is me.
Are relatively easy and simple to make, and it's a good way to reuse an old t-shirt. While t-shirt masks are not as effective as medical grade masks, they're an easy and effective way to protect yourself out in public when you're running your essential errands. Let's get started. To make this t-shirt mask, be sure to find a t-shirt that you can cut a 20-inch by 20-inch square out of. For reference, I'm using an adult medium. If you'd like to measure out the 20-inch by 20-inch square on your t-shirt, feel free to find a tape measure or a ruler and a marker to help out.
And also you'll need the 2 hair ties for this video, so be ready to have those.
Let's start by measuring out the square. So the width is approximately 20 inches. It's okay if it's a little less or a little more than 20. And the length is 20. I'm going to mark where to cut right there.
Okay, so as you can see, I'm cutting along the side of the t-shirt here and I go all the way up to the marking that I made for the 20 inches. And then you're going to cut across the chest of the t-shirt and then back down the other side. So you should roughly get a 20-inch by 20-inch square. Might be smaller depending on if it's a child's t-shirt or an adult small or something like that, but I was using an adult medium. And to answer the question in the chat, yes, this was Yoda. This is a t-shirt I stole from my sister. And Mr. Golding, you can use multiple layers. In the video, we just demonstrated with the t-shirt, but we can integrate coffee filters and paper towels as well in this one, and we'll show you where you can do that. So I see everyone's busy cutting. Again, you're going to cut along the side of the t-shirt about 20 inches across the chest of the t-shirt and then down the other side. And then you should end up with a square-ish rectangle. Okay. So we'll wait a few more seconds here. And I know this is probably the most time-consuming part, but are there any questions in the meantime about the mask making so far?
We might not be able to get through it due to time, but if you want to go ahead and quickly discuss washing it,
Sure.
What's the best way, and that way we can utilize the lag type.
Okay, sounds good. So let us breeze through this t-shirt video real quick and I'll just play it without stopping and then we'll go over how to wash the t-shirt masks.
To start making the mask, fold your cloth in half. Then you're going to fold the top portion and the bottom portion toward the middle so that they meet halfway.
Next, you'll take the hair ties and pull the cloth through the hair ties like so. You'll want to make sure that the hair ties are about 6 inches apart. If you'd like, you can use your tape measure or ruler just to make sure. To complete the mask, fold both sides toward the middle, and to secure, tuck one side into the other like so. For added security, feel free to use some tape and secure the sides together. Now your mask is ready to wear. And go ahead and put your mask on. All right, so I know my mask isn't as beautiful because my cutting skills are not that great, but that's a brief overview of the t-shirt mask, and we'll share the links with you so you can follow along later. And now we will talk about how to best wash your masks, and I will share the screen here.
Okay, so now that we've shown you how to make a couple masks, it's important, of course, to keep your mask clean. And so there's really 2 ways you can wash your mask. You can use it in the washing machine, or you can wash by hand. So if you want to use the washing machine, you can wash your mask with your regular laundry. And it's important to wash it on the warmest appropriate setting. But if you want to wash by hand, you can do this by creating a solution of bleach and room temperature water. So it's 4 teaspoons of bleach to every 1 quart of room temperature water. You're just going to want to soak the mask in there for 5 minutes. And then afterwards you rinse with cold or room temperature water. With that in mind, we also would recommend that you have more than 1 mask if you have to wash it that frequently. For drying the mask, just like with washing, you can just include it in your normal laundry. But if you want to air dry as well, just place it under direct sunlight until it's dry.
Aaron, before you move on, there was a question on the chat about the mask.
I don't know.
Jennifer,
the answer to
oh,
that.
okay. Sorry for everybody who hasn't read the question. Jennifer is asking if it's effective to leave your mask on the dashboard of the car.
I don't know.
I think we talked about how it's usually better to actually wash your mask with some kind of a soap in case there are any kind of particles on there. The soap itself will help break up those particles, even though it'd be good to kind of dry it out in the sun if it is wet. We do recommend still washing it. If that's not feasible to wash it after every single use, as you saw, there's a lot of different ways to make your own masks at home. That way you have several so that you're not having to do laundry every day.
Right, and I've seen a lot of people on the dashboards, and I think they do it just because of convenience. But also remember, in your car, there's a lot of dust particles. I don't know about you, Jennifer, but my car definitely needs cleaning. So that can also build up a lot of dirt in your mask, and then if you're putting it on, then it's kind of like a dirty mask, even though it's convenient for you to remember to keep it. So keep it in a space that you know that you'll see it, maybe by your keys, or somewhere where you always look, and that way you remember to have it.
All right, and last but not least, I know we're starting to run out of time. We wanted to give you a quick rundown on how to make your own hand sanitizer. I know that a lot of times it's hard to actually buy ready-made hand sanitizer, but in case you come across a couple of the ingredients, you can make hand sanitizer yourself. Just a caveat, always remember that washing your hands with soap and water is always the best choice to do, but in case you don't have that feasibility, having some hand sanitizer in your bag is really good to have. Another thing to watch out for is that the FDA has recently put out a list of hand sanitizers that are actually bad for you. There's some chemicals that can soak through your hands and cause problems in your vision. There's a list that you can see a screenshot of on the slide, and also a link to the list so you can make sure the hand sanitizers you are buying are actually safe for you. So the things you need are very, very simple. The most important part of making your hand sanitizer is making sure you have 90% alcohol. I know some websites say about 60 to 90% is okay, but the thing with making hand sanitizer at home is that you don't know how dilute your alcohol will become once you add the aloe vera. So it's always best to just have more alcohol than less. So what you're gonna be doing is taking 2 portions of alcohol to 1 portion of aloe vera. In this example, we're using 1/8 cup of aloe vera, which is 2 tablespoons, and 1/4 cup of isopropyl alcohol, which is 4 tablespoons, and just taking an empty container, a clean spoon or something to mix with, and another empty container to actually hold it in. You can feel free to add essential oils or peppermint. And when it comes to the aloe vera gel, if you can't, again, find gel because of grocery stores not having it or what have you, you can actually use the real plant. You just have to slice it open and kind of take out the clumpy part and use the liquid part. And using that plant is actually nicer because the consistency of the actual hand sanitizer turns out to be a little bit more gel-like instead of liquid. And again, just make sure that you're using 2 parts of alcohol to 1 part of aloe vera gel. So is there any other questions, whether about the masks or about the hand sanitizers?
Okay, if there's no other questions, we've shared a lot of links in the chat, and I will be sure to send them to Diane as well. I appreciate everybody coming today. As you can tell, my 2 bosses are calling me in the background, so I'm gonna put myself on mute.
Oh, that's so lovely. You know, these were so easy to do. Thank you so much for showing us how to make these. Oh, look at that.
Thank you for following along. Oh, hey.
Oh, they're just beautiful children.
All right, well, thank you so much for this opportunity. We had a great time, and it was just, I hope, the beginning of many collaborations.
Yes, I hope so too. And thank you all for, you know, just being so willing to do this. And I look forward to the next time then. And just keep shining, everyone, okay? That's what we got to do here.
Thank you, everyone, for joining. Be safe.